Good afternoon. Hawaii, we are almost there. Your hard work, sacrifices, and diligence is paying off. The curve has been flattened. But as I will continue to say, until there is a vaccine or a cure, we are not out of the woods. We all still need to remain vigilant. For 10 days, we've had 6 or fewer new positive cases of COVID-19 here in the state of Hawaii. And there have been no new cases on the island of Kauai for more than 2 weeks. This is a testament to Mayor Kawakami's leadership and all of the people of Kauai. Keep up the good work. We can be proud of the job our healthcare providers are doing. They are on the front lines of this battle and are working to ensure that Hawaii has the capacity to handle the current level of cases and any potential surge. Joining us today is Lieutenant Governor Josh Green, who will provide an update on our statewide capacity and his healthcare initiatives. With Hawaii's low rate of infection related to the virus, we are looking to ease restrictions and will start to reopen our local economy. However, this will be done in a phased approach based on health data, science, and guidance from our healthcare advisors. Together with the county mayors, we are looking at ways to scale back mandates in a cautious, safe, and coordinated manner. I've approved requests from several county mayors. For Oahu, Mayor Caldwell will be announcing the limited reopening of businesses, including real estate services, car and truck dealerships, automated service providers, mobile service providers, and services provided on a one-on-one basis, and public and private golf courses. You'll be hearing more from the counties over the next few days. However, please keep in mind that there is widespread expectation of a second wave of cases, not just here, but on the mainland and around the world. So if we start to see a surge, some of the mandates may have to be reinstated. The sacrifice of keeping our community safe and healthy has come at the expense of more than 225,000 residents who are now unemployed. Today, I'm announcing the launch of a new system to specifically help residents who are usually not eligible for regular unemployment benefits, including the self-employed and independent contractors. The Pandemic Unemployment Assistance Program, or PUA, was made available through the Federal CARES Act. This is a new program with new requirements that had to be put in place by the state. This was a difficult process, and Hawaii is one of the very first states nationwide to bring it online at this time. And I'm pleased to say that starting this week, people can begin the application process for PUA relief funds. If you think you qualify, you should go to the state PUA website at pua.hawaii.gov. The CARES Act will also bring more than $2 billion in forgivable loans to Hawaii for our small businesses through the Payroll Protection Program, or PPP. To provide further assistance to Hawaii's small businesses, I'm announcing that payments received under the PPP program will not be subject to the state general excise tax. This also includes payments through PUA and the SBA's Economic Injury Disaster Loan Program. This will help ensure that the funds will stay in the hands of our small businesses so they can keep employees on the payroll and cover some additional operational expenses. The state has the ability to waive the GET on these payments through administrative action. However, due to current state law, PPP loan proceeds are subject to the Hawaii income tax. And we want to make sure that Hawaii businesses are not penalized. PPP loans are currently excluded from federal gross income tax, and we want to keep Hawaii consistent with the federal tax rules. So the Department of Taxation will be asking the Hawaii State Legislature to pass a measure next year that will allow our state to conform with federal rules. This will provide some relief to the more than 11,000 small businesses in Hawaii who receive the PPP loan. And we hope this number will grow as applications for the second round of funding started on Monday. And finally, Dr. Bruce Anderson is here to give the Department of Health's daily update. He will also be announcing a new digital tool that the department will be using to enhance our ability for contact tracing and monitoring. Again, thank you for your efforts in the fight against COVID-19. Stay strong, Hawaii. We are beating the odds, and there is light at the end of the tunnel. We are making a difference together. So please continue your hard work. Take care of yourself, take care of each other, and most importantly, take care of our community. Thank you.
Thank you, Governor. Our next speaker, Lieutenant Governor Josh Green.
Hello, everyone. Thank you, Governor, for all the good news. It's well appreciated by many. So thanks for having me. Today, we have just 4 new cases, just 4. It's an extraordinary thing that you've done, as Governor just said. No new fatalities today. So he stole my punchline, which is the curve is flat, and it's because of what you've done. You have succeeded in sacrificing for these 40 days after the governor's order to stay at home to keep us alive. Once again, it's extraordinary what you've accomplished. And because the curve is flat, because of that, you're able to hear what the governor had to announce. And I'm very excited about it as just a member of Hawaii to have the businesses begin to reopen in our Kama'aina economy. That is a very good thing, and it would not have happened without his order and your responsible behavior. So thank you for that. A couple things. Very briefly, let's talk about where we are as a healthcare system. 1,451 of our 2,773 beds are occupied. That's 52%. This is, of course, contributing to our capacity to open up businesses because we are healthy enough that we can take care of people if there's any spread of the disease. Number one. More importantly, probably, is our intensive care unit beds. We describe these as beds where people who are extremely sick need care. So only 101 out of our 244 intensive care unit beds, or 41%, have been occupied. This number and the hospital numbers are pretty low right now, mostly because we're not doing elective procedures and because you've made the sacrifice to stay at home and not catch COVID-19. Most importantly, our ventilators. So only 63 out of our 459 ventilators are being used right now. That's 14%. This number has hovered between about 11 and 15% from the beginning, which means we never saw a spike over the course of the end of March or all of April. We only had this very flat little hump of COVID-19, and this meant that we were able to keep our mortality rate or fatalities very low. We did lose some of our loved ones, and we'll talk about that in a moment. And then finally, the number of individuals that have been hospitalized to date with COVID, 68. And that number is, of course, a concern, but this is absolutely a tiny number as compared to the thousands or tens of thousands of people in other states that were hospitalized because they were not able to take the very clear orders that the governor put in place to make sure we were safe and healthy. Fatality rate. We've had 16 deaths of our people in the state of Hawaii. Now, this is the lowest mortality rate in the United States, very similar, although lower, than some of the other states that are extremely rural out west, like Wyoming or the Dakotas or Montana. So we have the lowest mortality rate, once again, because our healthcare providers and first responders have done extraordinary work and that we've worked together as one ohana, and that is critically important. Just want to mention a couple other quick things. As phase 1 is ending of the crisis and we move on to the economic recovery, Please do keep in mind that though we may have very few cases in the coming days, we could have some additional fatalities because some people are still in the hospital, and also the disease does affect people and causes chronic disease, some lung damage, some people have had heart issues after getting through a lot of the disease and then still succumb to it. So please understand that that may be something, and I wanted to prepare people for that. I'll just finally say you've been consistently strong. As we begin to form the next phase of this plan, and as businesses open, please do listen very carefully to the Director of Health and their team. Please make sure that when the mayors give you instructions, you also listen very carefully to them, and most of all, the governor. Do continue to socially distance. Do continue to wear your mask when asked. Do continue to be very careful, because the best thing for all of us as we go into phase 2 and restore our economy, the very best thing is to keep this virus wiped out. If we do that, it will be easier to bring tourists here in time. It'll be easier to keep our businesses open, easier to recover. So again, aloha, you've done something extraordinary.